Health Officer Kristin Pluta and Deputy Health Officer Matthew Budd. Good morning.
Good morning. How are you guys doing?
Morning.
Great. Good to be here.
I think this is the last day we can actually say Happy New Year.
Really? Oh,
yeah,
wow.
through January.
Okay.
Well,
Fair
you've had a
enough.
long time because January is like the longest month
Does it
ever.
feels like 2 months?
Yeah.
It's over today.
It's over today. We're going to celebrate, and then we're going to have a short month, and then we're going to be in spring before we know it.
Yeah, it feels like spring right now.
One of the things in the news today is in the West Coast cities, they've declared a fentanyl emergency, and they're mobilizing teams. It's really out of control, and it's kind of, fallen off the front page, but it's still a big issue, and it's a big issue here.
It's growing.
Yep.
Yeah.
It's a big issue, and it's a big issue here as well.
Mm-hmm.
It's one of the things I gave you to talk about today,
Yeah,
kind of last year, coming on to talk about last year in review, and opioid settlements coming into the state have been talked about for a while now. The health department was a recipient of the first Janssen & Janssen, J&J settlement. We have a health educator working full time on opioid work, opioid prevention, making connections in the community. And we recently just were approved to, there's an additional $3.6 million coming into the county for opioid remediation and prevention services. And we're gonna, once we start receiving those funds, we'll be putting out an RFP and managing what other community organizations can
It's
use
amazing
that.
how big of a problem this has become in the country. And I think you mentioned, it's not on the front page of the paper today, but it could be literally every single day. It's not just fentanyl, there's some other stuff out there too.
Yeah, xylazine. Xylazine, I think, is a horse tranquilizer, right? Yeah, horse tranquilizer started, I think, on the East Coast, but they call it the zombie drug. Matthew could probably explain a little bit more what it does, but it's, they're finding not only the fentanyl, but the xylazine mixed with the medications that are doing, horrible things to
I think I
the users.
personally would stay away from something called the zombie drug.
Yeah, I think that would be best
That would
interest
be
for
wise.
health, but a lot of the time people don't know what they're taking.
taking.
They get told that it's one thing, and then they don't know that it's laced with some other drug, and generally it happens to help make the drugs give that person that same feeling, but with cheaper materials or more sedative materials that aren't actually that drug, just because it's cheaper for the person to make, and then that person who bought it doesn't really know.
I remember I was talking to Mike Hurst about this, and I said, why would drug dealers do something that would potentially kill their customers? And he said, they don't care. There's plenty of there's no shortage of customers. So it's just amazing kind of where we're at. But the part of what you guys do is that outreach and prevention, and not just in this area, but let's talk teens, sexual health. You guys are doing a lot in the schools as well.
Yeah, I think we've got a lot of really interesting things happening in the schools. Of course, March comes kindergarten roundups, and we're always a big part of those. Of course, helping parents know what they need to do with their kids to make sure that they're ready for the school year. One of the things I'm very excited about is actually our collaboration with Concord Community Schools. We are opening up what's called a school wellness program, which is going to be a school health center where we're going to have a nurse and a mental health professional on site to help the kids, work with the teachers and the staff and the parents to help address any type of health needs that they have.
And what a great benefit to that school system.
Yeah, we've been working really closely with Becky, the superintendent, and Mike Arbuckle, and a lot of other school staff that are really passionate about bringing this program there.
Yeah, so many different things you're performing outreach in. Of course, vaccination we talked about for the last 4 years. That's still a push. How are we doing?
I think we're doing pretty good. We wish more people would get the booster. It's important. It'll help reduce those severe injuries. Every month we still talk about COVID-19 and other types of emergency preparedness type information. So not only COVID-19, but we've talked about what happens if anthrax or explosions. So just kind of being prepared for whatever comes next, whatever that might be. But vaccination is still the best way to prevent any type of outbreak or illness.
Got a photo I have a question about. Stop the Bleed.
Yeah. So Stop the Bleed is a fantastic program, something we're really happy to be able to bring out to different communities. This program teaches lay providers, so lay individuals, people without medical experience, how to identify bleeding that might be life-threatening and how to stop it. how to save that person's life, because what they find is when someone dies to injury, about 20 to 30% of those people could be saved if somebody around them knew what to do. And that's kind of like, CPR and trying to get AEDs out in the field. So
Wow, that's interesting.
On Fargo last night, the girl used a knife scraper to create a tourniquet.
And that's really interesting, right? So we don't teach improvised tourniquets or anything like that, but we do show how to use a tourniquet, or if you don't have a tourniquet, how to apply pressure. Because I think it's the basics of bleeding.
Yeah.
If you're bleeding, try to keep as much blood in your body as you can.
Right. And no one's ready to use the tourniquet. No one's going into a situation thinking, I'll probably use a tourniquet in an hour. So it is important to try and be trained every once in a while.
You guys have a big team of health professionals, and you are further engaging them. You've got some team building that you've been doing?
Yeah, coming out of the pandemic, I think one of the big things we've really tried to focus on is there's been a lot of turnover in public health. There's been a lot of turnover a lot of places in healthcare, but
especially in Ottawa County.
Yes. We are fortunate not to have that high of turnover and not have some of that going on. But so we restarted, I think we revamped 2 years ago, the beginning of 2022, what was formerly our HPO team, which is High Performing Organization, but really just a group of individuals from all representatives of all areas of the health department to work on, it's now called the B team, Building Employee Engagement. There's a poster that we're showing right now about, they were able to talk about what we were doing and just some of the small things we can do to make our employees feel connected and engaged with each other. We spend a lot of time with our employees and the importance of that. We want our employees to be healthy and well and get along with each other, and how do you do that is by connecting. If we can do that, then we can better serve our community.
Every time we have you guys on, there's always a new initiative, constant improvement. Does that all come from you?
No, not really. No, it comes from it really comes from our team.
Yeah.
I think that is really, I can have an idea, but I can't do it all.
Yeah.
We have a great leadership team. We have a great team, in and of itself doing the work. So
The people who are with us at the health department, especially the people who've stayed the last 3 years, are passionate and they're excellent employees. They really want to do the best that they can in this community and the people they serve. Because the money's not there for public health. Public support is pretty good in some areas, but it's really people at the health department are driven by passion to do good by others. So it's a great environment.
Don's very passionate about environmental health. He lives, breathes, and all that. And do we have some concerns coming up this year?
Yeah, before we let you go, tell us about this algae.
Well, that was 2020. Last year. I think we had a busy summer. Don had a busy summer last summer with air quality alerts, the algae blooms on the lakes. That comes from a bacteria that just the certain right conditions puts this toxic bloom into the water that if you're exposed to it can make you sick. So. We're constantly watching those kind of things. You hear the PFAS, some of those things we're not involved with, or directly oversee, but we're still involved with as the health department.
A lot of things to protect and educate the public on. Amazing. Thank you guys so much for being with us as always.
Absolutely.
Thank
Thanks
you.
for having
Appreciate it. Kristin Pluta, Health Officer, and Matthew Budd, Deputy Health Officer from the Jackson County Health Department. More of the show after this.